So some people may experience fatigue or a headache or muscle pains, but these are all short-lived. And it seems that if you're older, you're much less likely to have these side effects. And certainly the second time around, you're less likely to have the side effects. But as far as longer-term side effects are concerned, infertility and sterility are very unlikely, but it is impossible to be categoric because I would be telling a lie. We've only had the vaccines around for a few months. I would take it straight away because I just would never want to either suffer with COVID myself or transmit it to somebody that I loved and have them suffer, not only because it's been killing hundreds of thousands and we know the numbers all around the world, but it's also causing longer-term symptoms in some people. So what we've heard of as long COVID symptoms of possibly as a result of end organ damage where people have difficulty breathing, they have extreme fatigue, lethargy, and they just can't get back to their previous selves before they had COVID, is lasting now for months and may last for even longer than that. And that does not sound like something we'd wish on anybody. So I would absolutely take the vaccine in order to protect myself and to protect the people that I love and to protect the community in general. I think it's the right thing to do. We have lived with influenza for hundreds of years. The reason that it's such a successful virus is the fact that it is able to mutate very quickly. This particular coronavirus does not seem to mutate as much, although I have to tell you, I'm not a virologist, but that's my understanding. However, we certainly have seen mutations, there is no question. The fact that we have this new vaccine technology that can be changed relatively quickly to give something that's efficacious, or that's at least what we're being advised, the mRNA type vaccines, means that we have the ability perhaps to be a step ahead of this particular virus. So I'm hoping we will be able to get it really well under control. To say we can eliminate it is something that I can't say with confidence. We have been trying, for example, to eliminate polio for decades. We have almost got rid of it around the world, but it remains present in, I think, 3 countries in the world. So there are things we have not been able to get rid of, and there are things that we currently control with vaccinations. Polio, measles. We control it because they're so infectious, they manage to stay alive. We don't vaccinate enough people, but we control it and we live with it quite successfully. It could well be that we come to a stage where we live with this coronavirus quite successfully, but we need to continue to take active measures, for example, vaccinations, in order to keep it at bay. What happens is that an mRNA vaccine is really a message. So it's like you receiving a letter or a message. It comes through to your own cells and it says to the cell, make some of the protein that looks a little bit like the coronavirus. And so then your own cell looks a little bit like the coronavirus, but it doesn't make you sick. And then your body's own immune system fights that cell and knows how to fight it in the future. The mRNA itself, which is the messenger, actually gets destroyed really quickly. So it doesn't stay around in your body for very long, and it certainly doesn't have the ability to change your own DNA. That's just not possible with this particular type of technology. There are different types of technologies that are involved, but all of them don't change your own DNA. That would obviously be of significant concern if it did, and that's one of the things that you look at in early studies of any type of technology. And the mRNA technology, although it's new to the vaccine field, has actually been studied for well over a decade in itself, in use for other things, for example, in cancer therapies. information that's come out from the Joint Commission on Immunisation and Vaccination from the United Kingdom, which is the body that's advised on how it should be used, have said absolutely a lot of the at-risk groups, or all of the at-risk groups, should come forward for the vaccination. It is possible that in some people with immune deficiencies or immune suppression, the vaccine may not work as well. It may not have such a good response if your immune system has been suppressed, but it depends a little bit on your particular circumstance, and your doctor should be able to advise if that's the case. But you should certainly come forward and take the vaccine, because it will afford you better protection from the potential of getting COVID. There is a long list of the people they particularly feel fall into this category, which include people with diabetes, people who have known to have heart conditions, people who've had organ transplants, people who are immunocompromised for whatever reason. And the list is quite long, and I don't have it in front of me to go through it, but it is there on the websites for us to see.
You still run rings around your kids or grandkids. You can show the young people a thing or two. You wouldn't say you're old just yet. You may not think you're vulnerable to COVID-19, but you are. High-risk individuals with COVID can get long-term damage, including lung damage, brain fog, and loss of smell. In some cases, they may die. People age over 60 are strongly encouraged to get vaccinated for yourself, your family, and the community to keep yourself healthy and feeling young. For information on how priority individuals can get vaccinated, visit hsa.ky.
The COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Cayman-kind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. We, you, are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me, you.
One of the reasons for this is that funding gets released. We saw when there was the Ebola crisis that when it became a public health emergency of international concern, funding was released, and that enabled people to work towards a vaccine much faster. Here, funding was available immediately for this, relatively immediately for this public health emergency. And it meant that people could do things that are not normally possible, such as to stack different parts of trials on top of each other so they could run things concurrently, which they'd normally do in sequence, but instead they were able to do all of the things at the steps at the same time, as well as work on some vaccines that may likely fail, but they had the seed funding available in order to start work on them. In addition to that, you were able to start to manufacture vaccines right at the beginning of the process that you thought were likely, even though the trials hadn't yet been completed. So a lot of different steps led to the speed. Another factor is many of the agencies that are reviewing the information about the studies, the practical data, the study data that comes out, we're able to do this in a rolling way rather than do it all as a bunch, receive a huge bunch of papers. They're working on the data as they received it so that they're able to arrive at their decision fairly quickly. We know that short-term side effects certainly are present. So some people may experience fatigue, or a headache, or muscle pains, but these are all short-lived. And it seems that if you're older, you're much less likely to have these side effects, and certainly the second time around, you're less likely to have the side effects. But as far as longer-term side effects are concerned, infertility and sterility are very unlikely, but it is impossible to be categoric because I would be telling a lie. We've only had the vaccines around for a few months. I would take it straight away because I just would never want to either suffer with COVID myself or transmit it to somebody that I loved and have them suffer, not only because it's been killing hundreds of thousands and we know the numbers all around the world, but it's also causing longer-term symptoms in some people. So what we've heard of as long COVID symptoms of possibly as a result of end organ damage where people have difficulty breathing, they have extreme fatigue, lethargy, and they just can't get back to their previous selves before they had COVID, is lasting now for months and may last for even longer than that. And that does not sound like something we'd wish on anybody. So I would absolutely take the vaccine in order to protect myself and to protect the people that I love and to protect the community in general. I think it's the right thing to do. We have lived with influenza for hundreds of years. The reason that it's such a successful virus is the fact that it is able to mutate very quickly. This particular coronavirus does not seem to mutate as much, although I have to tell you, I'm not a virologist, but that's my understanding. However, we certainly have seen mutations, there is no question. The fact that we have this new vaccine technology that can be changed relatively quickly to give something that's efficacious, or that's at least what we're being advised, the mRNA type vaccines, means that we have the ability perhaps to be a step ahead of this particular virus. So I'm hoping we will be able to get it really well under control. To say we can eliminate it is something that I can't say with confidence. We have been trying, for example, to eliminate polio for decades. We have almost got rid of it around the world, but it remains present in, I think, 3 countries in the world. So there are things we have not been able to get rid of, and there are things that we currently control with vaccinations. Polio, measles. We control it because they're so infectious, they manage to stay alive. We don't vaccinate enough people, but we control it and we live with it quite successfully. It could well be that we come to a stage where we live with this coronavirus quite successfully, but we need to continue to take active measures, for example, vaccinations, in order to keep it at bay. What happens is that an mRNA vaccine is really a message. So it's like you receiving a letter or a message. It comes through to your own cells and it says to the cell, make some of the protein that looks a little bit like the coronavirus and so then your own cell looks a little bit like the coronavirus, but it doesn't make you sick, and then your body's own immune system fights that cell and knows how to fight it in the future. The mRNA itself, which is the messenger, actually gets destroyed really quickly. So it doesn't stay around in your body for very long, and it certainly doesn't have the ability to change your own DNA. That's just not possible with this particular type of technology. There are different types of technologies that are involved, but all of them don't change your own DNA. That would obviously be of significant concern if it did, and that's one of the things that you look at in early studies of any type of technology. And the mRNA technology, although it's new to the vaccine field, has actually been studied for well over a decade in itself, in use for other things, for example, in cancer therapies. The information that's come out from the Joint Commission on Immunisation and Vaccination from the United Kingdom, which is the body that's advised on how it should be used, have said absolutely a lot of the at-risk groups, or all of the at-risk groups, should come forward for the vaccination. It is possible that in some people with immune deficiencies or in immune suppression, the vaccine may not work as well. It may not have such a good response if your immune system has been suppressed, but it depends a little bit on your particular circumstance, and your doctor should be able to advise if that's the case. But you should certainly come forward and take the vaccine, because it will afford you better protection from the potential of getting COVID. There is a long list of the people they particularly feel fall into this category, which include people with diabetes, people who have known to have heart conditions, people who've had organ transplants, people who are immunocompromised for whatever reason. And the list is quite long, and I don't have it in front of me to go through it, but it is there on the websites for us to see.
You still run rings around your kids or grandkids. You can show the young people a thing or two. You wouldn't say you're old just yet. You may not think you're vulnerable to COVID-19, but you are. High-risk individuals with COVID can get long-term damage, including lung damage, brain fog, and loss of smell. In some cases, they may die. People age over 60 are strongly encouraged to get vaccinated for yourself, your family, and the community, to keep yourself healthy and feeling young. For information on how priority individuals can get vaccinated, visit hsa.ky.
The COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Cayman kind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. You are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me, you.
of the reasons for this is that funding gets released. We saw when there was the Ebola crisis that when it became a public health emergency of international concern, funding was released, and that enabled people to work towards a vaccine much faster. Here, funding was available immediately for this, relatively immediately for this public health emergency. And it meant that people could do things that are not normally possible, such as to stack different parts of trials on top of each other so they could run things concurrently, which they'd normally do in sequence, but instead they were able to do all of the things at the steps at the same time, as well as work on some vaccines that may likely fail, but they had the seed funding available in order to start work on them. In addition to that, you were able to start to manufacture vaccines right at the beginning of the process that you thought were likely, even though the trials hadn't yet been completed. So a lot of different steps led to the speed. Another factor is many of the agencies that are reviewing the information about the studies, the practical data, the study data that comes out, we're able to do this in a rolling way rather than do it all as a bunch, receive a huge bunch of papers. They're working on the data as they received it so that they're able to arrive at their decision fairly quickly. We know that short-term side effects certainly are present. So some people may experience fatigue or a headache or muscle pains, but these are all short-lived. And it seems that if you're older, you're much less likely to have these side effects. And certainly the second time around, you're less likely to have the side effects. But as far as longer-term side effects are concerned, infertility and sterility are very unlikely, but it is impossible to be categoric because I would be telling a lie. We've only had the vaccines around for a few months. I would take it straight away because I just would never want to either suffer with COVID myself or transmit it to somebody that I loved and have them suffer, not only because it's been killing hundreds of thousands and we know the numbers all around the world, but it's also causing longer-term symptoms in some people. So what we've heard of as long COVID symptoms of possibly as a result of end organ damage where people have difficulty breathing, they have extreme fatigue, lethargy, and they just can't get back to their previous selves before they had COVID, is lasting now for months and may last for even longer than that. And that does not sound like something we'd wish on anybody. So I would absolutely take the vaccine in order to protect myself and to protect the people that I love and to protect the community in general. I think it's the right thing to do. We have lived with influenza for hundreds of years. The reason that it's such a successful virus is the fact that it is able to mutate very quickly. This particular coronavirus does not...
3, 2, 1. Hello, everyone, and welcome to today's press briefing. I'm Donna Bush. As always, I'm so glad that you could be here with us on our various CIG television channels as well as on Radio Cayman. We begin with today's prayer from Pastor Ashley White.
Father, in the wonderful name of Jesus Christ, our Savior, I come to you. Thank you for the direct access today. As a nation, we recognize that it is because of your mercies why we are not consumed. Your mercies are new every morning. Great is your faithfulness. Today I pray for our governor, premier, members of parliament, and those in authority. I pray that you give them wisdom to execute their duties in a way that is pleasing to you. I pray for the protection of all healthcare professionals and frontline workers. I pray for cooperation from residents and visitors alike. I pray for the protection and provision for all residents. Give us the wisdom to do our part to keep these Cayman Islands the great place it has been. I pray for the total eradication of COVID-19 virus in the name of Jesus. I ask, Sovereign Lord, that you help us to be thankful always. In the holy name of Jesus, our Savior, I pray. Amen.
Thank you, Pastor White. Before we begin today's press briefing, I'd just like to note that any questions from the media or the public today should only be related to COVID-19 updates from our panelists and not campaign, election, or politically driven. First, we'd like to welcome our panelist, His Excellency the Governor, Mr. Martin Roper, our Premier, the Honourable Alden McLaughlin, Minister for Health, the Honourable Dwayne Seymour, and Minister for Finance, the Honourable Roy McTaggart. In studio with us today are members of the media, the Medical Officer of Health, Dr. Samuel Williams Rodriguez, and invited guest. First, we go to our Honourable Premier.
Thank you, Donna. Hello, everyone. I am pleased to be with you today to bring some good news regarding government's national vaccination program. As a country, we have done extremely well with the vaccine rollout, and we can all be very proud of this. There have been nearly 320 million COVID-19 vaccinations given around the world. In the United Kingdom and the United States, the Pfizer-BioNTech vaccine accounts for around half of them. Here across our three islands, we have given almost 28,000 doses, with many of these being the completion of the two-dose course. I can further report that some 31% of our population of around 65,000 people have received at least one dose, and 15% have had a full course. As many of you would have heard me say on several occasions, we would need to have 70 to 80% of all residents fully vaccinated to allow us to safely open up our borders while keeping other protections in place. We have a ways to go still to achieve that goal, but we are certainly well on the way, and we have many to thank for this. So let me start by extending sincere thanks to all the staff at the HSA for working tirelessly to roll out the program, to the United Kingdom and the Governor's Office for supporting us in this opportunity for our people, and to you, the public, for coming forward and availing yourselves of this protection. Increasingly positive information is being received for the success of the vaccinations which have been approved for use by the World Health Organization and stringent regulatory authorities such as the United Kingdom, United States of America, and the European Union. Only recently, we have learned that the Pfizer-BioNTech and AstraZeneca vaccines are likely to give a good degree of protection not only against the infection itself, but also protection against the transmission of infection from one person to the other. Further to this, studies are now showing that although some of the variants of concern, which have caused many countries to double down on their border controls for fear of spread, the approved vaccines continue to offer protection against serious illness and death. Information available only this week suggests that the protection offered by the Pfizer-BioNTech vaccination offers protection against one of the Brazilian variants of concern, something that has taken a while to come to light, but we are glad that it has become known. I'm extremely pleased to also announce that we have reached a much anticipated milestone in the delivery of our program, in that we have now vaccinated well over 91% of those in our population over the age of 60. This gives us confidence that the most vulnerable have been protected from the worst of the COVID-19 disease. With this target having been met, I am able to announce today that from the 22nd of March, the required quarantine period will be reduced from 14 to 10 days for those who have completed a valid vaccination program at least 2 weeks before traveling to the Cayman Islands, provided that everyone in their quarantine group has also been vaccinated. Other requirements are that a traveler must provide a negative PCR test that was taken no more than 72 hours prior to departure, A negative PCR test is also completed when arriving on island, and the traveler is staying in a group where all people have received a full course of the vaccination. And that to be released from quarantine, the traveler must receive a negative PCR test. Here in the Cayman Islands, we do not believe we have any community transmission of COVID-19, which is a most enviable position to be in. Therefore, we still maintain a degree of caution for three principal reasons. Firstly, vaccination is not 100% effective. It works exceedingly well, but there will still be some people in whom no immune response develops in spite of having completed the course. Secondly, although a good deal of protection is afforded by vaccination, there is still a small but finite chance that a fully vaccinated person might have a good immune response, but might still be able to carry and transmit the virus to someone else. Thirdly, the variants that are of concern need to be followed very carefully. We have seen a worrying increase in infectivity, which will have a direct knock-on effect of the numbers needed to be vaccinated to ensure good community protection. The Ministry of Health is watching developments both in terms of understanding of the disease and the effectiveness of the vaccines. We're also monitoring what happens around us for those travelers who wish to come to Cayman. The prevalence of COVID-19 disease is falling rapidly in the United Kingdom and the United States due to combinations of non-pharmaceutical measures such as masks, distancing, and hygiene, and a rapid rollout of the vaccinations. This will be coupled with the arrival of springtime in the Northern Hemisphere, and the coronavirus family tend to be seasonally affected, so this will likely add to a further fall in infection rates. If the falls in infection prevalence continue and our vaccination numbers continue to rise, we should be able to further reduce the quarantine period while watching the variants of concern. When we reach the threshold that a substantial percentage of the population will be vaccinated, then we should be able to remove the need for quarantine altogether. But to reach a rate of, for example, 80%, it is likely we will need to have vaccinations available for children too, which should be coming by the summer. There are a few other changes which the regulations will bring that I will touch on. Should a traveler provide a false vaccination certificate, then the person will have committed an offense and will be liable on conviction to a fine of $10,000 and to 2 years imprisonment. Medical vaccination certificates can be submitted in electronic form. Before closing, I repeat again that we have so far successfully managed our response to the pandemic and have started on the road to recovery and eventual reopening. Let us stay the course and stay safe. If you have not already done so, please come forward to be vaccinated. You are not only doing so for yourself, but also for your family, your loved ones, and the community at large.
Thank you very much, Premier McLaughlin. Your Excellency.
Thank you very much, Donna. Good morning, everybody. As the Premier has said, it is wonderful news that 90% of our over 60s have now been vaccinated, and that means we are now able to begin reducing the mandatory quarantine period for incoming vaccinated travellers from 14 to 10 days, and it is the start of a cautious, gradual and safe opening up of the islands that we all very much want. I'm also very pleased that as a result of the supply of the Pfizer vaccines from the UK, we were able last week to further open the supply of vaccines to anyone over the age of 16. So far, the UK has sent Cayman 38,000 vaccine doses. Tomorrow, approximately 20,000 additional doses will arrive on the BA flight from London. We have a further 20,000 doses arriving on the 25 March BA flight, so 2 weeks tomorrow. And then I'm pleased to be able to announce that what we will say is the final delivery of approximately 23,000 doses is expected on the BA flight on the 7th of April. And as I've said before, these vaccines will continue to be supplied free of charge, and all of them are the Pfizer vaccine. So after the final delivery on 7 April, we will have received over 100,000 doses, which is enough to vaccinate the entire adult population of 50,000 people in Cayman. So that means that by early May, all of those over the age of 16 who want to be vaccinated could have had a second dose of the vaccine. I think this is a fantastic achievement, especially as the supply of vaccines around the world remains such a challenge. And I just want to take a moment to reflect that on 13th of March last year, we closed schools across our islands. On the 22nd of March, we closed our borders. It's been an incredibly long year and a really tough one for everybody. The community in Cayman has really rallied around, and we can all be proud of the progress we have made. But if anyone had said last March that by May this year we would have a safe, reliable vaccine against COVID, and we could have vaccinated all adults in the Cayman Islands over 16, not many of us would have believed it. So we have come a long way, but that achievement is within our grasp. And as a community, I hope it's an opportunity that we will all grasp. So I urge everyone to take the vaccine when invited to do so. As the Premier said, about 3/5 of our adults have now had one dose. In the UK, that figure is 23 million, and over 100 million in the US have had one dose. So vaccines are being rolled out to millions of people across the world with no serious side effects or complications, and that applies equally here on our islands. And as the Premier said just now as well, really excellent news that the Pfizer vaccine seems to be effective against the Brazilian variant, and there is good emerging evidence that these vaccines are safe against these new variants. Of course, we have to remain cautious because new variants could emerge. But the data in the UK is very clear that for over 70s, the vaccine is highly effective at stopping hospitalizations, serious illness and death. So it is the way for each of us to protect ourselves and our elderly and vulnerable relatives and friends. These vaccines have been trialled on many tens of thousands of people. They've gone through rigorous testing, and hundreds of millions are now receiving them across the world. So once again, I urge those who perhaps still remain hesitant not to listen to unsubstantiated, false and irresponsible conspiracy theories. Form an objective view from trusted, official and objective sources. Talk to people who have had it. Think about protecting your loved ones. The objective case for taking vaccines is a powerful one. Once again, let me finally just urge everyone coming into our islands from overseas to follow the protocols to help keep everyone here safe. Our systems continue to work very well, and we've avoided any community transmission. And I do want to pay tribute to the civil service, which has done a heroic job in keeping it that way. And a reminder, there are strict penalties for anyone breaking the rules, and where there is evidence, they will be enforced. In conclusion, let me thank Health Services Authority for an outstanding effort on the vaccination rollout. Thank you again to everyone in the community for what you have all done individually to get Cayman into this positive situation, one of the most favourable anywhere in the world just now. The vaccine rollout gives us much hope and confidence for the future, and we're now in an incredibly good place to reopen safely and bounce back strongly from this global pandemic that has so tested the entire world. Thank you.
Thank you, Your Excellency. Now we go to the Minister of Health.
Thank you, Donna. Good morning, everyone, and thank you for joining us. And we continue to keep you informed about government's ongoing COVID-19 related measures and vaccine updates. Thank you to each of you as you continue to do your part by participating in the vaccination program. The latest numbers, if you've heard, it's approximately 28,000 vaccines having been administered as of yesterday, and with 9,447 having completed the 2-dose course. It is most noteworthy to highlight the uptake has been amazing, and we want to continue this trend as we do all that we can do to continue our current direction in this regard. Many thanks to our public health professionals who continue to do an amazing job with administering the vaccines. We thank you. I'm pleased today to also be announcing a further round of stipends to our musicians who continue to be affected by the continued downturn in our tourism and hospitality industry. This additional one-time stipend of $1,000 will be paid by April the 2nd. Persons who applied previously and received the stipend do not need to reapply. Our ministry team will reach out to you over the next couple of weeks to reconfirm your details. Persons who did not previously apply and are now seeking assistance should contact the ministry's policy advisor for culture, Natasha Powell, at natasha.powell@gov.ky or on 345-244-2369. That's 244-2369 to obtain and submit their application. Deadline for new applications is March 19th. Also, I'm pleased to provide an update on the second round of the Health Insurance Premium Payment Assistance Program through the Ministry of Health and in conjunction with the Health Insurance Commission, which recommended on March 1st, the Health Insurance Commission vetted 220 applications and assistance has been provided to 984 persons for March 2021. As previously announced, the program is scheduled from March through June 2021. Unemployed workers from the tourism and hospitality industry are encouraged to access the program if in need of assistance. For persons who did not apply in time for the March assistance, the deadline to submit an application to the Health Insurance Commission to obtain assistance commencing from April 1st is on March 19th. Applications should be made through the Health Insurance Commission. Persons may contact the Health Insurance Commission via email to hic@gov.ky or by phone on 946-2084 for additional details about the program or to obtain an application form. My thanks again to the ministry staff and the Health Insurance Commission as we seek to ensure that this assistance is available to our people. In closing, as my normal, Proverbs 3:5-6, trust in the Lord with all thy heart and lean not on your own understanding. In all your ways acknowledge him and he shall direct your path. Thank you and God bless.
Thank you very much, Minister for Health. We now move to the Minister for Finance, Mr. Roy McTaggart.
Thank you, Donna. A very pleasant good morning to the viewing and the listening public. In keeping with my promises that I made last year to update the country, my purpose this morning at this press briefing is to provide you with the unaudited financial information with respect to government's financial year that ended on the 31st of December 2020. The information I provide this morning is the same information that was reported on to my cabinet yesterday at our weekly meeting. It bears repeating that the COVID-19 pandemic started having an impact from the third month in government's fiscal year, that is March. Much earlier in the 2020 financial year, government was faced with the possibility of having a deficit as high as $168 million. I've said previously, and I report again, I'm pleased to say that the 2020 deficit is substantially less than the $168 million feared earlier in the year. The unaudited financial results show that central government itself ended the 2020 financial year with an operating deficit of approximately $38 million. This is comprised of operating revenues of $789 million and operating expenses, financing costs, and other costs of $827 million. It is particularly pleasing to report that the shortfall in revenue for the year was only $35 million compared to our budget. This, despite the shutdown of the second pillar of our economy, tourism, for 9 months of the year. Additionally, at the 31st of December 2020, government's debt balance stood at $248.6 million. Now, with the Cayman Islands having an estimated gross domestic product, or GDP, of $4.7 billion at the 31st of December 2020, a government debt balance of $248.6 million means that our debt to GDP ratio was 5.2%, which would put the Cayman Islands squarely in a very favorable position of having one of the lowest debt to GDP ratios in the world. And government's bank account balances stood at $447.6 million, of which $104.3 million represents the island's general reserves. Now, the 17 individual ministries, portfolios, and offices that make up central government each have now prepared their own annual report, which includes their unaudited financial statements, and have submitted these to the Auditor General's office for examination by the statutory deadline of February 28th. The majority of these audits are to be completed by the 30th of April. The Treasury Department within the Ministry of Finance now has to consolidate these 17 sets of financial statements with those of the 25 statutory authorities and government companies in order to produce a set of financial statements for the whole of government or for the entire public sector. And these have to be sent to the Auditor General by the 31st of May. One of the reasons the deficit isn't as significant as initially projected and feared was the great performance of a few of government's revenue streams and categories. When compared to the original revenue projections for 2020, the following revenue categories outperformed those original projections. Stamp duty on land transfers exceeded its initial 2020 projection by $20.6 million. Private fund fees, which is a new category of revenue or a new revenue stream for government, which came into effect with the implementation of the Private Funds Act in 2020, yielded $5.7 million in the 2020 financial year. Other revenues had a favorable variance of $4.2 million, which is made up of $1.7 million with respect to sales of supplies and other items to jurisdictions in the region to combat COVID-19 and to other local and on-island healthcare facilities, and $2.5 million of revenues from the air bridge flights. And donations had a positive variance of $2.9 million. And this includes a donation of $1.8 million from Mrs. Oldie towards a cost related to the COVID-19 mitigation. The improvement in the deficit also came about due to certain expenditures having incurred less costs at the end of 2020 than initially budgeted. These categories are personnel costs were less than budget by $6.7 million, and supplies and consumables showed savings of an underspend of approximately $27.3 million. It is very important, I believe, that the public understands that the unaudited $38 million deficit is after or takes account of a significant level of COVID-19 expenditures being incurred in 2020. Were it not for the occurrence of this necessary expenditure, government would have produced the normal, usual annual surplus. The unaudited figure for expenses incurred to the 31st of December, which came about because of COVID-19 mitigation, is approximately $65.4 million. Some of the major elements of this overall total are health-related, quarantine, PPE, and other costs totaling $32.3 million. $15.6 million was incurred to provide financial assistance to displaced Cayman tourism workers. $4 million awarded as grants and technical support to micro and small businesses. The total facility made available by government for this purpose was $9.5 million. $2.2 million was spent on arranging the air bridge flights, but The revenues received from such flights exceeded the costs incurred. $2.1 million was incurred in the cost of putting standby borrowing arrangements in place in case government needed to undertake borrowing. We did not incur any borrowing in 2020, and government does not intend to incur borrowing unless it becomes absolutely necessary for us to do so. $2.1 million was also used to provide temporary financial assistance to persons in need to assist with their living expenses. $1.9 million incurred with respect to the laptop initiative that got in government schools undertaken during the COVID-19 pandemic and the lockdown. $0.8 million was spent assisting seamen, veterans, and persons receiving personal financial assistance. It has been the political leadership and strong financial stewardship of this government that I believe has brought us to this point. However, I hasten to add that the pandemic is not over, not by a long shot. Government continues to be challenged by the extraordinary demands for assistance and services from our people who are experiencing unprecedented hardship. We will be continuing to assist wherever we can do so. In closing, I take this opportunity to thank my cabinet and the caucus colleagues, the Deputy Governor, and all civil servants who have worked so diligently and tirelessly to keep our country safe and continuing to deliver for our citizens during what is a very difficult time. I thank you.
Thank you very much, Minister McTaggart. We're now going to open the floor to members of the media for questions for our panelists as well as for the Medical Officer of Health. We begin by inviting Wendy from CNS to the podium.
Thank you, Donna. Morning, everybody. I think I'm going to start with Dr. Williams, if that's all right, just for a couple of questions with the vaccines. Dr. Williams, the only question really, but it's sort of probably got bits and parts to it. A lot of people have been speculating about side effects, about people getting sick after the vaccine, that kind of thing. Have you been able yet to collate any figures and give any kind of reasonable sort of explanation of the types of side effects that you're seeing, how many or a percentage of people that are suffering from them, and what the most serious ones have been?
Hi, morning. Thank you for the question. Yes, we do collect information on all the side effects. We actually have to report to international organization WHO and PAHO on these side effects. So far, the most common side effects are the ones that are usually we advise the public that will likely can happen, and that's pain on the side of the injection, low-grade fever, and that should last 1 to 2 days and normally go away without any medication or simply with taking some regular paracetamol or Tylenol. We have received reports of a person who has had some more serious side effect, or the same side effect but lasting for a longer period of time, 4 to 5 days. A couple of these patients have had to seek medical attention. None of them have been admitted due to this side effect, and we have not had any report any serious side effect that need to be reported to the public at this time.
So just to clarify, no one's been admitted to hospital with any serious side effects?
Not to my knowledge, no.
But there's been some that have gone to doctors or whatever?
Yes, correct.
But you can't give us an idea of the sort of level of impact it's having, just numbers-wise, about how many people you've seen where it's been quite...
The percentage, because not everyone report their side effects.
Okay,
so the percentage reported to us have been very low. I don't have an exact number, but it's very low percentage reported. But we know that patients have experienced this side effect that we have based on initially.
Okay, so it's mainly pains in the arm and a low-grade fever. We haven't had people sort of passing out or people getting sort of symptoms of the virus, that type of thing.
Not really. We haven't received a report of people having symptoms of the virus. We did have received a couple of reports of patients feeling faintish during the process of minutes after receiving the vaccine, but none of them have needed admission or hospitalization.
Is it possible that people are fainting? Because we've had a lot of reports about people fainting, but I remember at school when people used to faint when the nurse came with needles. So is it like people faint because they see a needle, right?
Yeah, that happened. And it's not only with this vaccine. We know that there are reports with other vaccines of patients fainting. There is a group, actually younger individuals tend to faint more often than other individuals when they're into the vaccination.
Okay, thank you for that. I just wanted to get you on the record because there's a lot of rumour and speculation. It's best to get you saying it. I think the other questions I have about the vaccine are for the Governor. Governor, the vaccines that are all coming, are they all still Pfizer, or are we going to get the AstraZeneca as well at some point?
No, they're all Pfizer. We are aware there's a very small number of people who, I think for medical reasons, would prefer to take the AstraZeneca vaccine. So we are looking into that, and it may be possible we can get a very small delivery. But the Pfizer vaccine is the one that we are getting in Cayman.
Okay. So you're looking to get a small amount.
But it's a very small number of people who've said they, for medical reasons, would rather have AstraZeneca than Pfizer, because they are different types of vaccine. So we will obviously try and support on that, but I don't have any details at this stage.
I'm a bit stumped, you see, because I was going to ask you a whole load of other questions, all of you, but I'm not allowed.
You're not allowed. I have to leave if you're going to go down that avenue. That's why I'm here.
Wendy. Not allowed.
Unless, I'm happy to leave if you wanted to go into more political issues. It's up to the Premier and his colleagues.
No, the next one is actually for you. It's, or in general anyway, it is about the breaches, especially now that we're going to be reducing the timeline. Again, these cases, there just hasn't been any further prosecutions, and some are stretching a long way back. And also, I understand that there are some problems with the technology, especially with one of the breaches that did actually get as far as the courts, I understand. But in actual fact, it seems, according to the case, that the message came through that they were free to go. And so either the technology, I mean, I'm not saying whether they're lying or not, but there appears still to be some technology problems. So can you explain to us what's going on with these breaches?
I mean, you've raised this before. I mean, I think that the first thing to say is that we have an independent judicial system, so we have to let that run its course. So the police will prepare any cases, and they will go to the Director of Public Prosecutions, who will decide whether it proceeds to court. So we have to let that process operate in an independent way. All I can say is that a lot of these cases are quite complex, and you have to have the right information to be able to move forward. But I think we should all take comfort in the fact that these processes and systems to protect people from people coming in from overseas are working. We haven't had any case of COVID being transmitted to the wider community. So, I think we just have to let the independent judicial process run its course. And if there is clear evidence to prosecute someone, then I have every confidence that the authorities will do the right thing.
Also, with regards to the vaccine certificates that we're going to need now, I don't know whether this is maybe a question for the Premier, will our staff get trained on spotting? Because apparently there's a huge trade already going on the black market in false vaccine certificates around the world. So will there be some training about recognising false certificates and things like that?
Well, I don't have specific information about that, but I would presume that to be the case. It's obviously been acknowledged by the authorities that this is an issue, which is why this new provision is being put in the regulations to deal with persons who provide a false vaccination certificate. But I don't have any specific details about the training and so forth.
Okay. Also, moving on to, are there any other changes beside the 10 days to the few limitations that we have at the moment? So like things like the crowd size, you're not going to go beyond 1,000, you're not going to lift that or anything, even with the election. I know I said the word election there, but I meant more technically.
Not at this stage.
You're still not going to do it?
Not at this stage.
So that's the only change, it's just the 10 days. Okay. Does anybody know, I'm not sure because we don't have anybody here, what our global citizen number is at the moment that have taken advantage of that? the Global Citizen Program?
No, I don't. I don't have that information at hand. It's easy to obtain, but I don't have it at hand.
Yeah.
Okay. The last two questions I have are for Mr. McTaggart. Given what you said about the deficit and basically had we not had to spend the money on the COVID itself, we would still have had a surplus, which tells you something, or at least it seems to me, about the collection of tourism revenue. So from a perspective of Finance Minister, what message are you getting from that situation regarding tourism revenue, and how much tourism revenue did we actually lose as a result of the lockdown?
Wendy, I honestly can't give you how much we actually lost. I just don't have it. But I think you have to put it in perspective. You have to remember that we had we had most of the high season from January to March, 22nd, when we closed down. So a very significant portion of the tourism revenues that we would have collected last year were indeed collected. And so, but, we start 2021 now from a position of zero, rather than maybe 30 or 40%, whatever the percentage might be of the revenues that we might have collected through from January 1 to the lockdown.
So can I get that figure from your office, do you think, about what we actually lost specifically in tourism revenue?
I can get figures.
Okay. Also, the last question I have is really, as you said, the pandemic isn't over yet. And globally, I don't know whether it's just because people are not really looking at it, but do you get a sense yet of how it might impact us from an economic point of view, a global economy point of view, throughout this year in particular coming ahead?
Well, you see things starting to very significantly improve. And for us here in Cayman, I think it is particularly gratifying to see that the U.S. economy itself, they have returned to growth. And that, I think, bodes well for us when we can finally get to a point where we start to welcome tourism back to our shores. Unemployment in the U.S. has come down quite nicely from the highs. It's like, I think the last figures I saw for February were like 6.5%. So all of these things are starting to indicate to me that that economically, certainly the developed countries are starting to, particularly the U.S., where 80% of our business is done with anyway, is certainly returning to growth. And we should benefit from that quite significantly.
And we're not seeing any impact yet on offshore at all? The Premier might be able to answer that.
For 2020, I think what we saw was that the number of incorporations and licenses were down, but they were still up quite significant, still up. 2019 was an incredible year for us in that there was growth of somewhere between 25 and 30%. Last year, the growth was somewhere in the region of 13 or 14%. So that's the only thing that we have seen. I mentioned in my presentation the new fees that we're getting from the Private Funds Bill and a Private Funds Act. We collected $5.7 million, and that came into effect, I think, probably sometime in August. So you had maybe 4 months at tops, 5 months out of the year, right. And we collected 5.7. Now, that should transfer quite well over because for all of the thousands of them that we registered in 2020, we collect fees for those for the first time this year. So I think we said in 2020, there were some 13,000 entities that were licensed. That revenue came into our books in January.
So that's not even been counted yet? Okay.
Yes.
I'm with you. Thank you very much, gentlemen. That's all I have.
All right. Thank you very much, Wendy. I have a couple of questions before we go to Reshma at the Compass. Probably Dr. Samuels or Enriquez can answer these questions. Persons want to know what ages will be covered by the vaccine that's approved for children?
We don't have the vaccine yet, but it's likely 12 and over.
12 and over. Also, I think the Premier may have already mentioned this, but this question is asked, if everyone in the house has been vaccinated and one person travels abroad, does the whole family have to quarantine if that one person wants to quarantine at home?
Well, with the current regulation, they will have to quarantine for 14 days. When it changed, they will still have to quarantine. For 10 days.
Okay.
At this time. Yes.
Okay, thank you.
Right.
Reshma?
Any questions?
Good morning. Thank you, Dr. Williams. First of all, are the non-residents who have been vaccinated being counted in the overall percentages that we have today?
The amount of non-residents who have been vaccinated is very minimal. We have control over that, but they are counted in the total number of vaccines given.
Okay. So what if we have a handful of people away? Sorry, what if we are a handful of people away from reaching the target that we need to reopen, but there's still people who are simply refusing to be vaccinated? Is there anything that your public health is going to be doing to address that?
Public health, alongside with the government, continue to encourage the person to be vaccinated. Vaccination is not mandatory, so we cannot make it mandatory to anyone. The decision on policy decisions made by the government, not really by public health, but we will continue to advise the public and encourage the public to get vaccinated now that millions have been vaccinated around the world, and we see no serious side effect from the vaccine, and it's very effective.
Now, bear with me. This one is a little lengthier question. Now, Dr. Lee was quoted last week as saying quarantine protocols would be revisited once 80% of the overall population, including children, were vaccinated. And the Premier earlier had said 70%. Can you just, explain the discrepancy in the numbers? Is it that we're looking at two different moving targets?
I don't think there's any discrepancy, actually. I think the Premier actually has mentioned 80% as well.
Mm-hmm.
But there's no final decision on that. That will be based on our current situation in the Cayman Islands, and also around the world.
Yeah.
All right, no problem. This one is not particularly related to COVID, but more for the flu vaccines. It's that time of the year. The last check-in we had, we were awaiting some vaccine supplies. Do we have those vaccine supplies for the flu that can be readily available for those who may be,
Yeah, we do have flu vaccines available at the HSA, so the patient can follow the same process that they used to follow before, to not only at the HSA, but also on the district health center, and request the flu vaccine from the nurses if they want to get it.
Okay, this one may be between you and the Premier to answer. The World Health Organization has, in the past, advocated against a COVID passport. So 15 European countries are now looking at opening their borders with the creation of an electronic COVID passport. I know with the protocols you've indicated that you want the test, some sort of certificate showing that you have the 2 doses and that you have completed it with a health agency. Is that something that is being discussed here for us to have an implementation of a COVID passport for allowing people back into Cayman?
The COVID passport have been discussed. However, what we need is actually proof for individuals trying to Cayman area they have received a full course of an approved vaccine. They not necessarily need to be 2 vaccines, because as we know now, the last vaccine, the Johnson & Johnson, that has been approved in the U.S. is only 1 vaccine, and there may be other vaccines approved in the future. There may be only 1 dose instead of 2, but we definitely need proof from an official source that this patient has completed the vaccination course.
Okay, Premier, do you want to tackle that?
I can't improve upon that.
All right, no problem. Thank you, Dr. Williams. I think that's it for
Thank you.
My question relates to the governor's announcement today that we will hit the final total of vaccine deliveries will arrive next month. My question is, what happens with the COVAX facility that we've signed up to and the tranches that we were expecting? Will we be receiving the initial payment that we had made towards participating with that COVAX facility? What's the plan for that?
But I don't have those details, but obviously we won't need them. So we would ask that they be deployed to other countries that can use them.
Okay. But I think we were supposed to pay, I don't know, maybe the health minister can help us. Did we make any payment towards that facility, and would we be reimbursed with that?
I can get that information for you, but as the Premier said, we were due to receive vaccines from the COVAX agreement, but we passed that on because we thought that we were getting a regular supply of vaccines from the UK, and we thought other countries who hadn't got any at all needed to be afforded to get some. Yeah, but
Okay.
I'll get that information too for you about whether we paid or not.
Okay, I appreciate that. Now, Premier, you talked about an offense, a false vaccination offense. When will this be gazetted, the regulations that you've talked about today? When will those be updated?
22nd of March.
So the publication is on the 22nd of March?
The
Or-
regulations come into effect on the 22nd of March.
Okay, so when can we expect the publication, though?
I'm not sure when they'll be gazetted, but it'll be in advance of the 22nd of March.
Okay. So my question related to that is, this is an administrative change to the regulation, so you don't need the House to meet to create this new offense or anything like that. That's
No,
where what I'm getting
regulations
at.
are made by Cabinet, not by the House. They are subsidiary legislation.
Okay. Thank you. All right. The protocol changes that you talked about with the quarantining dates, what is the process going to look like for people who will be traveling with children under the age of 16 who, of course, can't be vaccinated?
They'll have to continue to be subjected to a 14-day quarantine.
Okay. Mr. Governor Roper, sorry. Has there been any discussions now that Cayman is getting closer to achieving the target of vaccinations? Have you had any discussions with the UK about revisiting the travel corridor initiative to allow us to have that travel restriction lifted for anyone heading to the UK from the Cayman Islands?
Not at this stage, and obviously it depends on what happens in the UK. But the news on that is extremely good. It's going in the right direction. So I would imagine that will happen, but not at this particular moment.
Okay, great, thank you, Mr. McTaggart.
Yes, ma'am.
Any chance you have any numbers for this year available yet? I know we're still in the first quarter, but there's some spending going on in terms of roadworks and so forth. Do you have any numbers that you can share with us related to this year?
At this point, I don't. I mean, the effort really in the ministry has been to get the year-end accounts prepared and reported. And I know that they're working on the January and February numbers, but it's not ready yet.
Okay, so based on that and the positive picture that you've painted, do we or are you considering accessing the line of credit anytime soon that we have agreed to?
We have no plans at this time to access the line of credit. It's there if and when we need it. And as we said all before, we would only use it, tap into it if it became absolutely necessary to do so. It's an insurance policy for us.
Mayor McLaughlin, you had something to say?
No, I was going to say that the work that the NRA are doing is work that was budgeted for, planned over the course of these 2 years. So it's not an extraordinary expense.
Okay, no problem. Thank you very much, Premier. Now, in terms of the changes to the protocols, I know that government is paying for the isolation for Caymanians and PR residents. Do you anticipate, or how much of a savings do you anticipate that we'll get from the changes in the protocols?
Clearly, there will be a decline because the cost per quarantinee, for each person quarantined will be quite less. Probably down by about 30%. But again, I don't have numbers that I could throw at you or give you as any sort of indication. But you're reducing the time spent in quarantine by about 30%. So there will be some there'll be savings in costs there.
Okay, I just had a question come in from a member of the public who's traveling around the 22nd of March, asking if, I know the date that it kicks in is the 22nd, but If someone is coming in on the 20th of March, would they still have to do the 14-day quarantine? I mean,
I'm afraid so.
Yeah. Okay, and I believe I had one final question.
They delayed the trip 2 days. They saved 2 days.
Yes, with the musician stipend. This is the second tranche, the second round of this. Do you have a figure on how much has been paid out to the artists so far who have applied for the stipend?
I don't want to guess. I'll get that for you very quickly, but I can confirm that no payments have been made on the COVAX arrangement.
Okay, so
Yes.
then there's no loss of funding.
No.
Okay, all right.
191,000.
191,000. Thank you for that. And
Yeah.
this one, I don't know, maybe it's the governor who will answer or the premier, but we had an announcement yesterday that Dr. Tasha Ebanks will be heading off to the UK across the pond. Who's going to be taking over Travel Cayman? How are you going to handle that transition?
That's for the DG.
That's for the deputy governor who isn't here, but I'm sure I've got every confidence he has it in hand.
Yeah, these are not political appointments. I don't know what arrangements are
I mean,
there.
it's a little, obviously that appointment, which many congratulations to Dr. Tasha. She's done an incredible job. I think we're all thrilled for her with that appointment. And I'm sure she'll be a wonderful representative in London. She does leave a big gap, but the civil service is very good at moving people around and finding equally good people to take up those roles. So I'm sure the deputy governor is on top of that.
All right, no problem. I know we heard from the governor about us hitting the milestone 1 year later. Premier, maybe you can share your own thoughts on looking back on where we were last year, our first case being confirmed, and the significant changes that we encountered in 2020 versus where we are right now.
Well, that was, I think, certainly the scariest period of my life because we didn't know what we didn't know because we had no ability to test. So we had no idea how widespread or not the virus was in the community. So that was an incredibly challenging time. And we were making decisions, a lot of decisions made in the dark, just made on the basis of judgment and common sense without any clear evidence to support them. And a lot of those decisions initially were challenged because who wants to go into lockdown? Who wants to have restraints placed on their ability to move around? But I know that the decisions we took, even though some would have thought, and many did say that, that we were overreacting, were absolutely the right decisions. Our strategy from the start was to seek to eliminate the virus in the Cayman Islands because we knew and understood by just seeing what was happening in other places that to do otherwise meant that you were going to keep having these surges and then you implement measures and you reduce the spread and then you reopen and then the surge starts again. So until we could get to the point where we are now, where there are vaccines available, we understood that our best hope for something approaching normalcy in terms of the life we can lead in Cayman required that we eliminate the virus in the community so that we could then lift the other restrictions and people could behave quite normally. So I am overwhelmed, quite frankly, at the success of what we've done. And I think we all have a lot of people to thank and God to thank for having delivered us this far. We just need now everyone who is able to take the vaccine to do so that we can get to the point where we can safely open the borders and our people can move around the world without great concern about becoming really ill or worse as a result of COVID-19.
Thank you.
Okay, we're going to move now next to Caymanian Times, Mr. Ralph Lewis. I do have one quick question for our Honourable Premier before that. The question relates to going forward, when the borders do open, will there be a capped place on the numbers of persons that can visit per month, just as there's a cap placed on the number of people that can gather at any one given time as we transition into a full open border at some point?
We haven't discussed that at all. It hasn't come up. I think we're still some months away from that particular point.
Okay, all right. Just a member of the public wanted to know. So, thank you.
Thank you, Donna.
Mr. Ralph.
Good afternoon, gentlemen on the panel. I'll be very brief today. There's 3 short questions. The first one is for the Premier. Are there any plans to allow visitors without connections to attend or visit the Cayman Islands if they're willing to quarantine for the 10 days after the 22nd of March?
We actually haven't discussed that either, but I think that would be something that we should consider. If people, I don't know how many people are going to want to come here, on vacation, and then spend 10 days, short-term vacation,
yes.
And then spend 10 days in quarantine. Obviously, people who come here to work, and there are quite a few people who are doing that, have to come in quarantine, and then they start their employment. But I think the number is going to have to fall below 10 days to significantly attract your usual leisure tourist. And because the average stay is 5 days for leisure tourists. So.
Okay, Mr. Roy, just 2 short questions regarding the economy. Do you anticipate that those revenue streams that you spoke about will continue to overperform for the next 6 to 9 months? Because we are still in our pandemic stage, right?
Yeah. No, I think the early indications are that they will continue. But at what level, I don't know. I don't have a good feel for that, and I don't have the forecast yet from the Ministry of Finance and the Economics and Statistics Office. But certainly, from what I see, those streams continue to perform quite well.
Okay, and the final question is, I know you're very cautious about how we approach the future, and you're very mindful that we're still in a crisis. And I always think about the availability of funds or disposable income for our residents. And will there be another pension withdrawal? And if not, or if so, what advice do you have for the people regarding how they spend their money, or the hard-earned money, or the small pocket change that they have going forward?
Ralph, you really asked some loaded questions. The issue in terms of a second pension withdrawal is not something that we have discussed at this point. In terms of advice, giving advice to the general populace, best advice I can give them is to do their best to budget their expenditures and create a budget and strive to live by it. At the end of the day, if you are spending more than you are taking in, you will shortly be in trouble. So people need to be spending as much as they take in or less than they take in. You always want to spend less, but understand where we are with the pandemic. People may not be able to save or to put money away, but it is important that they stand up and take responsibility for their own finances. And if they need help, seek it out. There are lots of people in the private sector that can assist in giving advice on these things. And so that's what I would suggest.
Thank you, Don. That's all for me today.
Okay, thank you very much, Ralph. Any further comments from panelists? Good. All right, we'd like to thank you, the public, and of course the media for joining us here for today's press briefing. Of course, to our panelists for sharing today's news with us. Remember, you can go online to gov.ky and to hsa.ky for the very latest on COVID-related information. Until next time, enjoy the rest of your day, everyone.